Today we study something about smoking tobacco. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Introduction. This is one of the most common preventable causes of premature death worldwide. So, tobacco smoking is one of the most preventable cause of premature death. Why it causes death? Because it contains multiple harmful chemicals and substances that increase risk of cancer. And tobacco smoking affects almost every organ of the body. Again, this is second-hand tobacco. The person doesn't smoke himself, but he inhales the smoke exhaled by the others. And this itself is called second-hand tobacco, and it has also similar effects as that of smokers. Origin. The tobacco comes from the leaves of a plant, and this is prepared and used for smoking cigarettes, cigars, and pipes. It can also be chewed and taken as snuff. It is a highly addictive nicotine and other chemicals. The various other chemicals such as carbon monoxide. Now this carbon monoxide has increased tendency to combine with hemoglobin, and this affects the oxygen supply to the body tissue, and so oxygen cannot be released to the various body tissues as per requirement, and carbon monoxide is one of the chemicals that is released by tobacco smoke. Also cyanides and many other harmful chemicals. Whenever a person takes tobacco, the instant effects to new smokers are nausea, dizziness, increased blood pressure, narrowed arteries, and increased heart rate. And as he continues to take tobacco longer and longer, tolerance develops, so that they have to take more and more tobacco. People who are regular smokers, they feel a bit relaxed, sharp, and calm. Various organs can be affected, and it is a risk factor for heart attacks, strokes, chronic obstructive airway disease, cancers, and many other diseases. And it is also a risk factor for miscarriages in pregnancy. So pregnant women should avoid smoking. Now let us see how it affects the lungs. It leads to loss of elasticity of lungs. So the lungs do not expand and collapse normally as the way we do in respiration when we inhale and exhale. So the lungs become a bit more stiff, and it causes chronic airway disease. The chronic airway disease can be classified in two types, emphysema and chronic bronchitis. Both have something similar, irreversible. There is shortness of breath, lungs cannot expand, and there's a wheezing sound coming from the lungs, and the patients have a persistent cough with sputum. How it affects the heart and blood vessels? It increases the heart rate disease and atherosclerosis. Atherosclerosis is a deposition of cholesterol. I made a video on cholesterol already, and peripheral vascular disease. So this cholesterol, it gets deposited in the blood vessels and causes them to clot. It depletes vitamin C. Vitamin C causes antioxidant, and so depletion of vitamin C increases the oxidative stress and leads to decreased blood flow in legs. So it increases cholesterol and fibrinogen. Fibrinogen is again required for clotting, so the tendency to clot with smoking increases, and reduces ability of oxygen to be transported by blood. As I already mentioned, the carbon monoxide is formed which combines with hemoglobin, so ability oxygen to be transported by blood is reduced. Kidneys. Again, there's increased risk of kidney cancer, and there's additional renal damages. It increases risk for chronic kidney disease, and in diabetics it promotes the progression of kidney disease. So if you have two patients who are both diabetics, otherwise similar, one is a smoker and one is a non-smoker, but Both are diabetics. In diabetics, the smoker will have the faster progression of kidney disease if he is a smoker. If he is a non-smoker, kidney disease will progress but not as rapidly. Mouth, especially tobacco chewing, can lead to lip cancer, tongue cancer, mouth cancer, throat cancer, lung, larynx, and esophagus. Bad breaths, leukoplakia. Apart from the many other causes, things can occur in the mouth due to tobacco. I am not enumerating all of them. Infection. Now it increases susceptibility to infection. Smoking, mainly the lungs, but yes, other organs also are more susceptible to infection. And in HIV positive males, it increases the risk of Kaposi sarcoma. Impotency and infertility. It leads to erectile dysfunction increases in males. In females, affects the ovaries, causing infertility. Causes increased chances of miscarriages in females. Stress. Nicotine dependency increases the stress. After quitting, stress is reduced. Mental. Continuous smoking increases chance of Alzheimer's dementia and dementia. Smoking is more prevalent in psychiatric patients. So you get 100 patients who are psychiatric, out of which smoking will be seen in more than the non-smokers. Pregnancy, it affects pregnancy, as I've mentioned previously, increases miscarriage chances, neural tube defects in the fetus, and low birth weight of the child. So how to quit smoking? You've got various mechanisms such as nicotine replacement therapy. Avoid triggers. So just suppose if you go and meet some friend or go to a particular area, you might be feeling like having a smoke there. Then you avoid those triggers. Avoid your friend or avoid going to that particular locality. Delay. So just suppose you have a desire to take a cigarette or smoke, then just say, I'll smoke a cigarette after 10 days, 10 minutes, 20 minutes, half an hour, 1 hour. So if you're smoking some 10 cigarettes per day, you may be able to reduce 1 by 2 initially. Keep chewing something with fibers such as nuts or carrots, etc. Now there's always a desire or temptation. You can say, oh, I'll smoke one only today, not more than that. Reduce that temptation. Then only you can quit smoking. Increase your physical activity. Practice relaxation techniques. You may require support from friends and family. There are also the presence of online support groups which help you to quit smoking. And obviously, think of the harmful effects and then you think yourself of the benefits. So it will be more easy to quit smoking. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share the link with your friends. Thank you once again.